Immune checkpoint inhibitors have revolutionized the field of cancer treatment and provided new hope for patients with advanced malignancies. These drugs work by stimulating the immune system to recognize and attack cancer cells, thereby enhancing the body's natural defenses against tumors. In this script, we will explore the mechanism of action of immune checkpoint inhibitors, clinical indications for their use, specific inhibitors targeting CTLA-4 and PD-1, combination therapies, immune-related adverse events and their management strategies, predictive biomarkers for immunotherapy response, alternative immune checkpoints beyond PD-1 and CTLA-4, resistance mechanisms and potential strategies to overcome them, the use of immune checkpoint inhibitors in hematological malignancies, future directions and emerging checkpoint inhibitors, as well as cost-effectiveness and access issues in immune checkpoint inhibitor therapy. Let us delve into each of these topics to gain a comprehensive understanding of this cutting-edge approach to cancer treatment. Immune checkpoint inhibitors target specific proteins on immune cells or cancer cells to promote an immune response against tumors. One key protein targeted by these inhibitors is cytotoxic T lymphocyte-associated protein 4, CTLA-4. CTLA-4 normally acts as an inhibitory receptor on T cells, dampening their immune response. However, by blocking CTLA-4, immune checkpoint inhibitors release this inhibition, enabling the immune system to mount a more effective attack on cancer cells. Immune checkpoint inhibitors have demonstrated remarkable efficacy in a range of cancer types. They are commonly used in advanced melanoma, lung cancer, renal cell carcinoma, bladder cancer, and Hodgkin's lymphoma. These agents are often reserved for patients who have failed standard therapies or in situations where the cancer has metastasized. CTLA-4 inhibitors, such as ipilimumab, block the inhibitory action of CTLA-4 on T cells. By doing so, they enhance T cell activation, proliferation, and cytokine production, leading to a robust immune response against tumor cells. Ipilimumab has been approved for the treatment of advanced melanoma and has shown durable responses in some patients. Programmed cell death protein 1, PD-1, is another important immune checkpoint receptor expressed on T cells. Cancer cells often exploit the PD-1 pathway to evade immune detection. PD-1 inhibitors, such as pembrolizumab and nivolumab, block the interaction between PD-1 and its ligands, PD-L1 and PD-L2. This disruption unleashes the immune system to attack cancer cells more effectively. To maximize tumor regression and enhance patient outcomes, researchers are investigating the use of immune checkpoint inhibitors in combination with other treatments such as chemotherapy, radiation therapy, targeted therapies, and other immunotherapies. Combining these therapies can synergistically augment the immune response and overcome resistance mechanisms. While immune checkpoint inhibitors have shown significant clinical benefits, they can also induce immune-related adverse events, IRAs, due to their systemic immune activation. These IRAs can affect various organs, including the skin, gastrointestinal tract, liver, endocrine glands, and lungs. Prompt recognition and appropriate management of these IRAs are crucial to ensure patient safety and treatment continuation. Identifying patients who are likely to respond to immune checkpoint inhibitors is of paramount importance to optimize treatment strategies. Biomarkers such as tumor PD-L1 expression, tumor mutational burden, and the presence of specific genetic alterations have shown promise in predicting immunotherapy response. Ongoing research aims to refine these biomarkers and develop novel predictors. While PD-1 and CTLA-4 have been the primary targets of immune checkpoint inhibitors, other immune checkpoints are also being explored. For instance, antibodies targeting lymphocyte activation gene 3, LAG3, and T-cell immunoglobulin and mucin domain-containing protein 3, TIM3, are currently under investigation. These novel targets offer new avenues to enhance the efficacy of immunotherapy. Despite the remarkable success of immune checkpoint inhibitors, not all patients respond to treatment or develop resistance over time. Resistance mechanisms can be intrinsic or acquired and involve alterations in antigen presentation, abnormal T-cell infiltration, tumor immune evasion, and immunosuppressive cell populations within the tumor microenvironment. Investigating these mechanisms is essential to develop strategies to overcome resistance and improve patient outcomes. Initially, immune checkpoint inhibitors gained prominence in solid tumors, but their use is now expanding to hematological malignancies. Clinical trials have shown promising results in Hodgkin's lymphoma, non-Hodgkin's lymphomas, and multiple myeloma. Harnessing the immune system to treat these cancers represents a significant advancement in the field of hematology. The field of immune checkpoint inhibitors is rapidly evolving, with numerous clinical trials investigating novel agents and combinations. Researchers are exploring new pathways, such as T-cell immunoreceptor with Ig and I-Tim domains, TIGIT, and V-domain Ig suppressor of T-cell activation, VISTA, which may serve as targets for future immune-based therapies. As with any medical intervention, cost-effectiveness and accessibility are important considerations in the use of immune checkpoint inhibitors. These therapies can be expensive, limiting access for some patients. Ongoing efforts aim to address these issues and ensure equitable access to this cutting-edge treatment modality. The advent of immune checkpoint inhibitors has transformed the treatment landscape for a wide range of cancers. Through their ability to unleash the power of the immune system, these agents have demonstrated unprecedented efficacy and durability in clinical trials. However, challenges such as immune-related adverse events, resistance mechanisms, and access limitations remain. Continued research and collaboration among scientists, clinicians, and policymakers are crucial to maximizing the benefits of immune checkpoint inhibitor therapy and improving patient outcomes in the future.